Serious. Doctors and nurses have read it. What was the creepiest, scariest thing you heard from patients before they died? Please remember to like, share, and subscribe. I work on a ward for elderly with dementia. We had one patient who was pretty well in the beginning stages of dementia. She had very little medication and could still do a lot by herself. One day, I put her to bed like every night, and she asked me when I would be back. I told her I had an early shift and would see her in the morning. She looked me in the eyes and told me with a smile that she wouldn't be here. I asked her why not, and she told me that she would be dead. I discussed this with a fellow nurse because it was something she had never said before and decided to check all her vitals. Everything was well within limits, nothing raised a red flag. But when I came to work the next morning, they told me she passed away an hour before my shift started. I still find it creepy how she could have known she would die that night. Had 3 patients all pass away within a week. They were all on different parts of the ward and all asked who the little boy in their room was, and within an hour of asking, passed away. I'm a med tech, and from where I am, we do the phlebotomy, blood extraction. There's actually 2 creepy instances that I personally experienced. 1. 2 a.m. extraction for an elderly male in the ICU. Since it's early in the morning and the patient is conscious, I have to give him a light shake to wake him up to gain consent for blood extraction. While he was slowly waking up, I was turning the lights on while prepping and explaining to him the procedure. Me: "Sir, good morning. I'm from the laboratory. I'm here to extract blood from your blood works." Elderly male seems a little irritated. "I thought you don't allow visitors this late." Me, thinking he's probably still half awake, and I explained again. "Yes, sir. We don't allow visitors. You can't have watchers staying in the ICU as well. But I'm from the lab. I'm here for your blood works." Elderly male seems a little confused. "Okay, I guess. But you have to get rid of that kid." Points at the foot of the bed, right beside me. "It's annoying that he keeps watching." Me just froze in place, trying to look steady as I can as I try to look at my side. There's no one, obviously, so I laughed it off, thinking he might not be that lucid, especially since it's the ICU. I did the extraction, and he didn't comment about it anymore. Morning comes, and he passed. Whenever I will tell that story to other people in the lab or outside people, we all have one theory. That kid was fetching him, and he went along and passed. 2. Another late-night extraction on a normal ward. Patient in her mid-50s, a female, and has late-stage cancer. I did the same and introduced myself and explained the procedure. She's lucid and smiling, and she even greeted me. In our local language, she greeted me, "Kamutsa kayo." Kayo could have meant 2 things. 1, an indirect approach, so it would sound more respectful, or 2, a greeting for a plural number of people. So kamatsa kayo is either hi to you, indirect, or hi to you all. From the get-go, I really thought it was the first. Anyway, she even prepped her own arm, putting a pillow underneath it for support. While I was prepping for my other stuff, she casually starts the conversation with how the doctors always ask for last-minute lab tests, and not surprising, it's always late at night. She went on how it disrupts everyone's night, lol. Her: "I mean, look at you. You're here at midnight and would probably get frustrated because of thin veins and your lack of sleep." I laughed it off because it's partially true. "You shouldn't have brought someone else." She was already hard to extract even before, since chemo does things to the veins, and I was actually in deep thought how to extract blood from her, so I didn't take much mind in what she meant by that. I moved in closer by her side so I can palpate the veins, but I noticed she never stopped looking at the empty area by the door. Her: "So, what he, our local language is gender neutral, gonna do now? She just gonna watch?" I laughed it off because I was in really deep concentration. Haha, I didn't know how to react to that. I was thinking maybe she'll stop with the jokes eventually. Some patients does the ghost joke, but I then realized she was dead serious and actually tried talking with whatever she was seeing in that empty space, like smiling and waving for it to come closer. Her: "So are you an intern or just observing?" Looks at me when she didn't get a response. "Is she your intern? Is that why she's just standing there?" I was baffled by that point that I was about to tell her I came in alone, but I was only able to mutter it under my breath as she just stops herself, thinking she probably was talking too much of my concentration, trying to engage me into conversation, and so she shrugs it off. When I was done, I thanked her, and when I was preparing to go, she smiled again and looked at the space way past me and said, "I hope you learned something. Some of us do have tricky veins." I just smiled to shrug it off and thanked her again. She smiled and said in English, "Thank you to you both." Both? We had a patient who came in frequently trying to OD to commit suicide. The last time we cleaned out her stomach, she wasn't doing well. She whispered something to the effect of, "OMG, this time I did it." She died in the ICU not long after. I'll share a few with totally different vibes. Creepiest. Patient looking not behind me, essentially looking through me, asks, "Who's that man?" When I assured her it was just the two of us in the room and that she's safe, she responded, "Ah, so you can't see him either." After that, I had an okay moment. I got her comfortable in bed now that she received her pain meds. She smiled and said goodbye to me. As I walked away, she mumbled, "I suppose it's time." She died about 2 hours later. Wholesomest. An elderly woman with pneumonia due to COVID had been in the hospital unable to have visitors for months. I helped her FaceTime her son, who told me that she loves Jeopardy and asked if I could turn it on for her. I had found a woman of my own heart. When her son had to hang up, she cried with me about how isolated she felt and really broke my heart. I used my break that day to sit and watch Jeopardy with her. We had a great time, and I kicked her ass. As I tucked her in for bed, she grabbed my hand, thanked me, and tearfully told me that I had made her feel human and loved again. She died the next morning. My dad had a major stroke and was in the hospital for several weeks. He wasn't in much pain, but he also wasn't aware of what had happened to him and was conversational, but a lot didn't make sense. One afternoon, his wife and I were sitting with him when he said, out of the blue, "It's time to die now." We looked at each other, and she said incredulously, "Can he do that?" He hung on for a few more weeks, but not very lucidly. Last week, I took care of an older lady in septic shock, transferred to the ICU so she could get levo-fed. She was getting a little more disoriented as my shift progressed and kept saying, "I'm so scared. I'm so frightened." When I asked her what she was afraid of, she said she didn't know. I kept reassuring her that we were taking good care of her. She ended up coding and dying the same day on night shift. They always know. My great-grandmother went into a shock when she came to know my father passed away. We did not tell her about it, but she overheard a conversation a couple of weeks after the cremation. Within a few hours, she had completely forgotten our mother tongue and could converse only in English and Bengali, which she had not practiced for more than 80 years. The next morning, she told us that her parents, husband, daughter, my grandmother, and grandson, my dad, are waiting outside for her. She closed her eyes and was gone. My grandma was dying of lung cancer. She would always talk about dreams of fishes when someone was pregnant. The only people who knew my girlfriend and I were expecting was us, and she wasn't even showing any signs along with wearing baggy clothes to hide. My grandma had told me congratulations and that she and our baby are beautiful in the late stages. She ended up passing about 5 or 6 days later. Fast forward 2 years, my mom and dad have a picture of that same grandma and my grandpa hanging up. My grandpa passed some time before her, so my kids never got to meet them. My 2-year-old pointed at that picture and knew it was his Papa Gary. When I was a student, a dying woman told me, "Congratulations on the baby. She will have beautiful blue eyes." I was confused because I was 18 and I wasn't pregnant or planning. But 3 weeks later, I find out I'm pregnant and my girl has blue eyes. I haven't had creepy or scary patient deaths. I've held the hand of an old woman. She was little more than skin and bones. I believe she was actively trying to die while I held her hand and stroked her hair. She asked me why it was so hard to die and if it was this difficult for everyone. I will remember her for a very long time. I sincerely hope she found the peace that she sought. Other patient end-of-life events have been disturbing, but not in the way that I think this question is asking about. The fear in the eyes of someone about to be intubated, that sticks with you. You'll have some conversations with your loved ones about your end-of-life care. CPR is brutal. Consider what you would or wouldn't want done to or for you. Talk about it with your family. Find out what their wishes are. It will make it easier if you ever have to make decisions for them. A lot of people die in a very similar fashion, in an untouchable discomfort and pain. Every time you ask them to rate their pain on a scale of 1 to 10, they say 10, and they just beg and beg and beg for help. And so eventually, you just start bringing the morphine dose up and up, the Ativan dose up and up, until that, combined with their illness, brings them into a state of unconsciousness that they stay in for a few days and eventually die. It's sad, but I can't honestly say it scares me. I'm confident that in the same situation, I'll probably be able to take myself out before it gets to that point. Wasn't creepy necessarily, but painful and actually caused me a lot of nightmares for years. Context: I've been a nurse for 9+ years now. I've been an LPN at 18 after graduating early and became an RN at 19. This is a ton of responsibility for someone so young looking back. Was working on a medical floor. My first job. Had a 50-year-old woman come in as direct admit from her doctor's office, not through the ER, with chest pain, and started coding within minutes of me getting her in front of our spouse. She came back a few times, begging me for her life while attempting to resuscitate her, but after hours of trying to bring her back, she died in front of me. Dreamt about her begging for her life nightly for almost a year. Drank a lot of alcohol to cope. Made me very angry that her physician made the choice to not send her to the ER first because they were more equipped than the critical access medical floor I was working on without a physician. Anyways, I hope her family has found peace. A giant bald patient that everyone became familiar with shows up on the 5th floor asking if his family showed up yet. The nurse told him he was on the wrong floor. "Maybe they're visiting you on the 3rd floor where your room is," she said. His voice answered, "They're not down there. Goodbye, and thanks." The nurse called the 3rd floor desk and informed them of their wandering patient. It couldn't have been him. He died this morning. She looked up and he was gone. We never heard the electronic door behind him open and never saw him again. I once had a patient who was super sick, close to the end, and just chilling the bed as soon to die too. Out of nowhere, they were suddenly vehemently terrified, screaming, saying things like, "Oh God, no," and "Please, no," etc., then died. Whole thing was probably 20 seconds. I was a CNA, both in hospital and long-term care centers, until I messed up my back. I spent many hours on light duty after I hurt myself holding the hands of people who had no family to come while they died. But my most memorable patient was when I worked in the hospital. We had an older gentleman who was a one-on-one and in full restraints as he died because the meds they were giving him actually made him very combative. Shortly before he died, he managed to get out of all the restraints. Took about 5 of us to get him in new ones. He ripped out his IV and my shirt in the process. I will never forget him because of how restless he was before he died. It broke my heart, honestly. Maybe not saying it right before she died, but Grandma always said that sometimes some people don't die right away because they want to say goodbye to someone before they go. So, when my grandma was dying, everyone said goodbye but me. I just couldn't. I really loved my grandma. She was in the hospital for 4 months till the doctor said they couldn't do anything more, so I just stayed with her, waiting for it to happen. When her breath started to get shallow, I cried and thanked her for everything she had done for me and said goodbye. She died about an hour after that, about 10 minutes before I was supposed to leave because my cousin didn't have a ride, and she knew I was there because I didn't want her to die alone. I truly believe she made sure I was there when it happened. I would have been so mad if she was alone. I don't personally think it's that creepy, but some may think so. My granddad had cancer and got to a point where he wasn't 100% with it, but could still hold conversations very well and know what was going on around him. There's a picture up in his and my nan's spare bedroom that's one of my younger cousins when he was pretty young. A nurse came in to change his dressings and, while making conversation, she asked who he was. My granddad said it was his grandchild, George. My nan replies, "No, that's Ronnie. George will be the name of Paul's child if it's a boy. Paul is my dad. My stepmom was pregnant at the time, but the sex was going to be a surprise. He was adamant that the picture was of George and would hear no reason. Any attempts to tell him it was his other grandchild were brushed off. He died a few months later, maybe. I was like 10, so I don't remember the full timeline, but later on that year, my stepmom gave birth to a boy, and he was called George. So basically, my granddad predicted that I would get a little brother. Not doctor or nurse, my grandma died July 7, 2021 of brain cancer. Her last words, July 4th at 1:30, out of the blue. Nobody came. She never spoke again. All she wanted was to see her family one last time. Her family left her. Nobody showed up for her annual July 4th party. She died 3 days later alone. Her husband died on Father's Day 2013. My aunt took care of her. I feel bad for her. Me, my aunt, aunt's boyfriend, my father, and my mother all showed up every day to help out. My other 3 aunts only went to take grandma's, their mom's, stuff and leave.